Hello, everyone, and welcome to the University of Memphis School of Public Health iEARN Projects webinar. We're delighted to see so many people here from all around the world. Nicole, if you can go to our first slide, we will kick it off. Today's agenda. Today we're going to be introduced to some members of the University of Memphis School of Public Health. And they're going to share with us a model for public health education in high schools that they are piloting here with us at iEARN. They're going to share specifically about that course, Public Health in Action. They're going to talk about some of the curriculum components that will be important for our teachers around the world. They're going to share some work and some quotes from some participants who have engaged with this project already. And then they're going to talk a little bit about this semester and this academic year and what they have in store for us in the iEARN community. Finally, we're going to end with some Q&A. So while we wait, or as we prepare for the next part, I just want to give you a couple of reminders about webinars. So there is a chat box. If you find your chat box, make sure your messages are sent to all sent to all panelists and attendees to fully participate in the conversation. We look forward to hearing from you, and certainly we are happy to answer any questions that you might have for us. There will be certain points in the webinar where we'll be able to do that. If you have any technical challenges or need any support, please send a message to the panelists. Next slide, please. And now I am thrilled to introduce members of the University of Memphis School of Public Health team. I am actually going to hand it over to Cami Gayrand, who is their instructional designer and coordinator of special projects, who will introduce her colleagues and kick us off. Cami.
Good morning, everyone. Welcome virtually to the School of Public Health here at the University of Memphis. Before we get too into the depths of this course, Public Health in Action, I just wanted to share the team that you will be working with if you're registered for our course. So a part of the class, we have our Dean of the School of Public Health, Dr. Ashish Joshi. We have Dr. Lori Ward, who is one of our coordinators for global engagement. Myself, who has built out the class, so if you ever have those technical problems, I'm just one message away. I have Michelle Ju, who is our health informatics analyst and has been leading the presentations and grading your homework, as well as Nahar Kaja, who's one of our PhD candidates who also assists with some of the grading. If you have any questions for us, again, throw it in the chat or visit us at memphis.edu/publichealth. I'm ready for the next slide. So about the University of Memphis School of Public Health, just real quick, in case you haven't heard of us, we as a university are a Carnegie R1 research institution. We are at the top 5% of universities worldwide with this honor. If you want to click through so that those bullet points show up for everyone. Sorry about that. Specifically about our school, we are ranked 99th out of over 200 schools of public health. We have a 21% international student body. We have over 20 academic programs for students to pursue, over 200 community collaborations that start here in Memphis, Tennessee, and extend all around the world. And then our student body is roughly over 300 students this year, and we have over 800 alumni. We are the nation's first in a lot of different areas, including the model for public health education we're going to talk about today. We have the first public health diplomacy lab. We have over $27 million in research, and we are the first CAHME accredited master's program in Tennessee. Now I'm ready for that next slide. A little bit more about some of the programs that we do uniquely to the School of Public Health is this program of interdisciplinary public health certificate. It is one of the many pathways that our students have to get started on their education while in high school. And as you can see from this graphic on the right, is that there are many paths that can take you from where you are right now in high school all the way to a PhD. It's something very unique to our program, and it's something that really drew me to the University of Memphis when I was first looking for a job, as well as possibly furthering my own education. We can go on to the next slide. So specifically about this course, hopefully you saw us in some of the newsletters and the project book this year. This is the first health course that iEARN is offering, and we call it Public Health in Action. I'll get into some of the more specific parts of it here in just a few minutes, but it's a really unique course in that we want to connect you globally using iEARN so that you can solve public health issues around the world just from where you are. We here at Memphis can travel around the world within an hour of a session. And I think that's really unique, and what a lot of our participants enjoyed last year was being able to see, hey, I have a issue that I'm facing in my community. Someone else has it around the world. And here we are collaborating on how to make an impact from our classrooms and take that into real world change. Next slide, please. So our course is a 14-week course. We initially piloted it last year, broken into 7 weeks to do a fall semester and spring semester. This year, we're going to do a rolling admissions sort of plan. We are going to do all 14 weeks and let those deadlines go into the spring so that we can adapt best to your own education schedule. Those 14 weeks of courses include all of these curriculum components that you see on the screen. We want to make sure that we not only introduce you to public health and really see what the importance is, the different elements of data, storytelling, design, as well as give you and your students the tools to go out and start making those projects and change in the world that you wish to see, and share it here to just better broaden you and your students' horizons of what we can do with this field. Next slide, please. So with the course, the type of assignments that we have built in are your discussion posts and group assignments. We have individual exercise and projects, but it's up to you, the project facilitators and teachers, to kind of best guide your students on that workload of maybe this is a group project, maybe 2 people, or hey, my whole class is going to do this, and let's share it and see what other classes are doing around the world. We have some traditional quizzes and exams, and the last 4 weeks of our course is actually based on case studies so that your students are really getting the most up-to-date education and practical application of all of this. Within this past year, we started in the fall and had another course in the spring. We had over 70 students registered and participating, and we were active in 12 different countries, as you see here on the right. I will go to the next slide and hand it off to my colleague Michelle to talk about just some of the projects and feedback she got, especially working in the course daily on grading assignments and just helping students. And then I can go into the finer details of how the course is structured and that timeline.
So as you can see from this slide here, we actually are partnering with iEARN for our global community to really advance the Sustainable Development Goal number 3, which is good health and well-being. So that's really exciting for us because that means we actually really get to follow through with seeing what your concerns are within your communities locally, and then taking that on to the next step with creating projects and thinking through what it means to actually be healthier for yourself and for the community. And so that really means that we're looking at global peers on our critical health topics. And we actually go through different key concepts that will help you build a solid foundation in public health. Those being epidemiology, which is really looking at disease spread and surveillances, health policy, which is looking at the rules and restrictions and regulations that might be happening within your local, state, regional, and international health and global reach. And then community, which is what's really closest to home for you and what that really means. We actually build a structured and balanced theoretical knowledge through a lot of the case studies that we have. Last year, we actually looked at things as diverse as COVID and measles, disaster preparedness, and we also covered on the different topics within the 14-week course. Those range from entrepreneurship and actually thinking about sustainable and scalable solutions to things like health technology. So in today's world, we're actually looking at things that are known as interoperability, which means being able to talk to each other with our different types of systems of health, which might be different types of electronic medical records with the advances of wearable technology and so on and so forth. We also are looking at things like AI, so artificial intelligence, VR and AR, which is virtual reality, augmented reality, and how all of those pieces can actually help in a public health setting to really monitor and take a pulse on what's going on around the world. So a lot of this actually allows us to look at current public health challenges, which could be health inequities and global health crises. And we actually want to make sure that we're able to do so in a way that's actually very helpful for you. So we have a few quotes from people who actually, were able to preview the course last year. And I think they found it really helpful to think about what's going on in their communities and apply that in a real world setting. And then, being able to have that open dialogue with us is wonderful. Next slide, please. So here you actually see kind of a layout, and Cami here has awesomely put everything in so that it is actually laid out really well. You'll see that when you go to each lesson, you can click into each lesson and there'll be modules and information. We actually include the slides. We also have the lecture itself for you to watch. And then there's, as she said, quizzes, exams, discussion, which I actually think is the most helpful. For being able to kind of get your thoughts out there and so that we can actually have an open dialogue about what's happening. Next slide, please. Sorry.
So this is kind of a breakdown of the course, just to show especially how this past year, if you saw our course and were kind of interested, how we are changing it. So anyone who registers now can participate in sort of a weekly course. So that is something where we move lessons or topics each week. However, we are doing that rolling admissions so that we can do it more bi-weekly to better fit with your all's schedules. And then that way your students get a ton of feedback from anyone who happens to join later, that dialogue can continue beyond the class. So this is just a very hectic view of those options. And as always, I'm more than happy to extend deadlines and fit any assignments to fit your school schedule and your students' workload. And I think that is our presentation from us. We want to hear from you. And if you have any questions before registering, feel free to let us know here in the chat afterwards when this is posted. We're happy to respond as well. And I have our contact on the next slide, but I'll keep it here for now and hand it back over to our iEARN team.
Well, thank you both so very much for sharing sharing all that information about your project. I did see a question in the chat asking about, as you were talking about areas of public health that you discuss in the course. One of our participants was asking, are you speaking about both physical and mental health as well as other issues within health? So if you could elaborate on that a little bit.
Thing. So we actually look at health and well-being as a more of a holistic approach. So we're looking at everything. That could be your physical health, mental health, and also social and emotional well-being. Those are key in making sure that our communities are able to really thrive. And so we'll take different aspects of it through the course. We actually are giving you a foundation for how to think through those problems so that you're able to come out with solutions. I think one of the best things that we were able to see last year was actually some of the campaigns that the students and teachers came up with to do, whether that be creating infographics that they were able to share, or actually video messaging. I actually had an entire group do basically a rap video about what it means to have good health and hygiene. And we were also able to see different structured projects related to things like obesity and mental health. From our standpoint, the same curriculum actually pairs really well with some of the other initiatives that we do in the university. And you're able to actually put forth your projects into what we usually call as a hackathon, which is a case competition to really showcase what you've done. Some of the projects that were done through clubs and hackathon include a hygiene care closet that was rolled out to their classroom, or looking at how to really disseminate information related to STIs. So diseases that are actually sexually transmitted, and those infections, and how that really impacts our communities. So really looking at how to put forth that information in a high school setting or in a middle school setting, for instance, and what that really means. So it really takes you through the project building side. You don't need any prior knowledge of public health in order to participate. We actually try to provide you with all the tools that you need. It does require a little bit more effort and higher learning involved to actually start to put together a lot of the information that we put down. But I'm always happy to break things down even further, especially if you contact myself or Cami here, and we'll get on and let you know how to really workshop your ideas and make the class something that's really good for you. Let's see, how much time should teachers and classes be able to commit per week to participate in the Public and Health Action Project? I think so. Each of our lectures is about an hour, and then there's also time built in for discussion, questions. So they actually are posts, our prompts on the website. And then some of our assignments do take some time. So I would probably set aside, would you say like three hours?
Yeah, it's a three credit hour course. It's one of our dual enrollment courses, as we mentioned. So high schoolers and some of our university students are taking it, and it is a 3 credit hour. So that's what I would definitely probably estimate about 3 hours a week.
Yes, and so really putting in some time and effort to think through the problems and solutions. We're actually happy to help you, think through that dialogue. I don't think any of your questions are silly or, inappropriate. It's really just thinking about how we come up with solutions in a real world setting. If you say today that you're thinking about your primary concern is sleep, maybe you're working on a project to really track your sleeping, or maybe it's your steps. But you might want to come up with something that's a little bit more innovative than just writing it down. Maybe there's some sort of toolkit you can create, or something of that nature. It's really trying to find a solution to things that are happening around you. But we're also going to cover topics about how to gather research, how to think through your data, what it means to actually talk to people about what's going around the world, and that you're able to inform yourselves in a safe way, and that you're able to actually use that information to create something of value for yourself or someone within your community. So we're hoping that that's something that you take away. And the key takeaway that I'm hoping that you get is actually whether or not you decide to go into public health as a long-term thing for your future as a career. We hope that you're able to take the lessons you learn to apply it to your real life. So that's really, how do I be healthier as a person? How do I make those around me healthier, and what kind of decisions might I actually do within my future career that can actually bring me closer to, having health for everyone. So that might be like, if say you're looking at architecture, you might be thinking about sustainable cities and planning, or even like the building materials that go into like housing. If you're looking at things like art, film, journalism, for instance, you might take Cammie's path and actually come down and do a lot of the amazing graphics and media that she puts out that are on the behalf of public health. If you're really wanting to go into public health, we can go further and deeper. And then if you want to look at things like allied health or medicine, we can kind of help you think through those processes as well. We're hoping that this course is for everyone and that there's some sort of good takeaway from it.
Thank you so much. And I think you brought up a couple of really important points for the iEARN community. I think, folks, as Cammie shared earlier, we are lucky to have a course that has been created by a university with a lot of deep research and curriculum and thought behind it. And we know that all of our iEARN projects are deeply thought out, but this gives us a kind of a different lens from an academic and a research institute lens into our project work. And it is, as Michelle said, it can be up to 3 hours a week. Now, Cammie had shared one of the things, and thank you to those who piloted it with us last year, that may not be sustainable for all classrooms, which is why we have the bi-weekly, every 2-week kind of format. So then you would think about it as about an hour and a half. They're also, willing to work with us to think about like what would make this the most impactful thing for your class, for your after school, for your students who want to do a public health club, right? That would be wonderful if your students wanted to do a public health club at your school and engage in this as part of that process. And as they mentioned, this course this is for the iEARN community, but it is also connected to a broader range of young people around the world who are thinking about public health and involved in it. Now, while we are not involved in the dual credit course, can you speak a little bit about the certificate that all students who finish this would get from the university?
So obviously you all get an iEARN certificate, as you're probably familiar with, but the certificate option that we are offering now is an undergrad certificate, also known as the interdisciplinary certificate, and it is a few of our core classes such as public health in action. And so if it is something that you're interested in, we can get you into that program, and those are credits that directly transfer to our university as well as our program. And so it's something that, once again, we want to customize your education to best fit you. So it's just one of those many new pathways that we opened up for students to just really help them see what's beyond high school and what the field of public health can do for them.
So teachers, as you're thinking about this for your class, certainly through the Collaboration Center and through, you can reach out. We'll facilitate you being able to reach out to the group to learn a little bit more about like what this might mean for some of your students. And obviously our partners at the University of Memphis are excited to support you in educating our young people. We have another question, and I think it might have been answered, but I don't think it's a bad thing to answer again. Is it too late to join the Public Health in Action Project?
Never.
So as we said, it's a rolling basis. So you'll join when you're ready, and you'll go through our coursework. We're happy to extend deadlines. We just try to get you finished before the start of the next academic year for us. Just that way we're not overlapping with too many courses and having assignments and things like of that nature unfinished.
Fantastic. And is this a fully asynchronous, or is there a synchronous element to this project?
Yeah, when we piloted it, we were trying to meet synchronously, but that very quickly was just difficult to schedule. And so we ended up teaching it twice a week. We were offering office hours. So this year we're going to do it asynchronously just to hopefully, once again, fit everyone's schedules better. But we're always happy to jump on and host those office hours or re-record something if you have any questions.
That's fantastic. And you mentioned students in the project several times. Now, not all of our projects have our students log in and be in the project. Some of our projects are kind of teachers are engaged in the collaboration center and they bring things out to the classroom. While that could happen in this project, teachers, I would encourage you, and iEARN-USA can support you in this, in registering your students into this course. And I think it helps in several ways, right? They're able to engage in the resources in the collaboration center. They're able to look things up and see the resources and engage in discussion and dialogue, both with the researchers, but with other students around the world who are engaging in the project. Pardon me. Additionally, as you're thinking about those times, right? There's video lectures where your students are going to be learning really important content. That doesn't necessarily have to happen during your classroom time if your students have access to the collaboration center, right? If they have and they have ability to do that at a different time during the school day, at home, and then after school at some other place, right? There are parts of this project that you can have students do outside of your classroom as well, to think about that the amount of instructional time that it takes within the classroom. So there's lots of ways that they really thought about making it very flexible to fit into different classroom schedules. And finally, you mentioned a little bit about some other activities you did. You're going to brag a little bit. One of our iEARN members actually had an honorable mention at your last hackathon. So that was pretty exciting to see. And so through this course and through engagement, there are other opportunities for us to continue to deepen our students' engagement in public health. Did you, I'm sorry. I did see one more question. Will you be offering more projects in the iEARN community in the second semester in January to May?
Yeah, so I think we're just going to be offering this course. However, we may or may not be in talks with iEARN about some of the learning circle opportunities, as well as Michelle mentioned, the hackathon competition will be running along this timeline as well. So I'll have to keep you guessing, but most likely we will have a few other options in the spring. They just might not be as large as this class.
Sure. And another thing about the hackathon, our target date for actually hosting the pitch and award ceremony this year is March 27th. So we are hoping to have the announcement out soon so that people can start thinking about, what their project might be, how to plan that out, and start really ramping up into getting that put through and into our competition. Our hackathons have also always had a component with workshops where we can actually help you workshop your ideas. I even actually got on a call with people to really talk through what it means to have certain types of projects and what that might look like. I can only help you so far with coming up ideas because it is a competition, but I am very happy to support you exploring different options and what it might mean to narrow down the scope or expand it so that it actually really works. This is actually helpful, and I would do the same as well for the end project that comes with this course. Is really, if you have any questions, I'm always happy to help you workshop through a lot of this and think through what it means to create something of meaning or in value. As part of the course, I know instructors are always trying to gauge metrics, and the real metric is, are you able to create something at the end or think through a project, whether theoretically or actually translating it into a real world solution. The group that you mentioned from before with iEARN was from Uganda. It was a group called Musana Vocational, and they actually entered in a project related to upcycling and sustainability of plastics and creating that into chairs and furniture for their schools to actually continue to have nicer things for use. And that actually hits on, and it allows them to learn real world skills in creating something. So that's the workforce pipeline piece there. That's project work, and thinking through that. And then that's also green sustainability, and the overall experience actually helped people really collaborate. So it hit on the social health piece as well.
Fantastic. Thank you. And correct me if I'm wrong, the target student population is really what we in the US would call high school. It's a secondary level. It's really kind of 14 and up for students, though there could be middle school classes with sufficient support from a teacher that could be successful in this project as well, correct? Yes. Perfect.
Later elementary school kids actually put together different videos that were actually more of a public service announcement, but geared towards their peers. So they were kind of reels and highlights using music and combining that with a rap that they created to get the word out on hand washing.
That's fantastic. Well, thank you so much. Kristen, are there any more questions?
I don't see any.
Okay, wonderful. Well, thank you very much to our partners at the University of Memphis. iEARN folks, we will be sending this webinar out. As soon as we get information about the hackathon, you'll find it in a couple of different places. We'll send it out in our international newsletter. You'll be able to find announcements in the Collaboration Center. Also, if you have signed up for this course, I'm sure you will be hearing about it through the course as well. So as we get more information from the university, please look for it in those different areas. Again, we'll send a follow-up email with information from this, and we'll be posting this video so that you can please share it with colleagues and other members of the iEARN community. If you know of folks in your teaching community that are not yet members of iEARN but want to do this, let them know about it so they can join us in iEARN and join us with the University of Memphis. So thank you all for joining, and thank you so very much to our partners at the University of Memphis.
Thank you.
Thank y'all.
Thank you so